We hear a lot about menopause and the significant changes it brings for women as they age. But what about men? Do they go through a similar phase? It turns out, they do, but it's a topic that's far less discussed and often shrouded in mystery. This phenomenon is called andropause, sometimes referred to as male menopause, and it involves a gradual decline in testosterone levels that can significantly impact a man's life. Unlike menopause in women, which involves a relatively rapid and definitive drop in hormone production, andropause is a much slower, more subtle process. For most men, testosterone levels peak in their late teens or early 20s. After about age 30, these levels begin to decrease by roughly 1% per year. For some, this decline is barely noticeable for decades, while for others, the effects can become quite pronounced as they enter their late 40s, 50s, and beyond. This slow, creeping decline is one of the main reasons why andropause is so frequently overlooked or misdiagnosed. Its symptoms can easily be mistaken for the general stresses of aging, a demanding career, or lifestyle factors. Many men might feel something is off, but they attribute their fatigue or mood swings to a bad week at work or not getting enough sleep, rather than a fundamental hormonal shift happening within their bodies. So, what exactly is testosterone, and why is its decline so significant? Testosterone is the primary male sex hormone, but its role extends far beyond just libido and reproductive health. It's a crucial hormone that plays a vital part in maintaining muscle mass and strength, bone density, fat distribution, and even the production of red blood cells. It also has a profound effect on mood, energy levels, and cognitive function. When testosterone levels drop, the physical symptoms can be wide-ranging and affect multiple systems in the body. One of the most common signs is a noticeable decrease in energy and an increase in general fatigue. Men might find themselves feeling exhausted even after a full night's sleep, lacking the stamina they once had for physical activities or even just getting through a normal day. This isn't just feeling a little tired, it's a persistent sense of being drained. Another significant physical change can be an alteration in body composition. Men might notice a decrease in muscle mass and strength, even if they are maintaining their regular workout routine. Simultaneously, they might see an increase in body fat, particularly around the abdomen. This shift happens because lower testosterone levels can make it harder for the body to build and maintain lean muscle and easier to store fat. Bone health is also affected. Testosterone helps to maintain bone density, so a decline can lead to weaker bones, increasing the risk of osteoporosis and fractures later in life. This is a silent symptom that often goes unnoticed until a fracture occurs, highlighting the importance of being aware of the underlying hormonal changes. Other physical symptoms can include reduced libido or sex drive, which is one of the more well-known effects of low testosterone. Some men may also experience issues with erectile function. Additionally, physical changes like hair loss, both on the body and scalp, and in some cases, the development of breast tissue, a condition known as gynecomastia, can occur due to the shifting balance of hormones. But the effects of andropause aren't just physical. The psychological and emotional symptoms can be just as, if not more, challenging to deal with. Many men experience significant mood swings, irritability, and even feelings of sadness or depression. They might feel a lack of motivation or enthusiasm for activities they once enjoyed. This emotional turmoil can be confusing and distressing, as they may not understand the root cause of why they're feeling this way. It can strain relationships with partners, family, and colleagues. Cognitive function can also take a hit. Some men report experiencing brain fog, difficulty concentrating, or problems with memory. This can be incredibly frustrating, especially in a professional setting, and can further contribute to feelings of anxiety and a loss of confidence. The once sharp mind feels a little duller, and a name or a fact that was once easy to recall is suddenly just out of reach. So why is this condition, which affects so many men, so often undiagnosed? A huge part of the problem lies in a lack of awareness, both among the general public and, at times, within the medical community. Men are often conditioned from a young age to be stoic, to tough it out and not complain about their health issues. Many feel embarrassed or ashamed to talk about symptoms like low libido, mood swings, or a perceived loss of vitality. There's a societal pressure to remain strong and capable, and admitting to these changes can feel like a failure or a sign of weakness. Consequently, many men suffer in silence rather than seeking medical advice. Furthermore, the symptoms of andropause are nonspecific and can overlap with many other conditions. A doctor might attribute fatigue to stress, weight gain to a poor diet, and mood swings to depression, treating each symptom individually without looking at the bigger picture. Unless a patient specifically asks about their hormone levels or a doctor is particularly attuned to the possibility of andropause, a simple blood test to check testosterone levels might not even be considered. This diagnostic challenge means countless men are not getting the support they need. They might be prescribed antidepressants for their mood or told to simply exercise more and eat better, which, while good advice, doesn't address the underlying hormonal imbalance. Getting a proper diagnosis is the first and most crucial step. This typically involves a discussion of symptoms with a doctor, followed by a blood test to measure total testosterone levels. It's important to note that normal testosterone levels can vary widely, so a doctor will interpret the results in the context of the individual's specific symptoms and overall health. Once diagnosed, there are various ways to manage the effects of andropause. Lifestyle modifications are often the first line of defense and can make a significant difference. Regular exercise, especially a combination of strength training and cardiovascular activity, can help boost testosterone levels naturally, build muscle, burn fat, and improve mood. A balanced diet, rich in whole foods, is also essential. Ensuring an adequate intake of nutrients like zinc, vitamin D, and healthy fats can support hormone production. Managing stress through techniques like mindfulness, meditation, or hobbies is crucial, as the stress hormone, cortisol, can suppress testosterone production. Getting enough quality sleep is also non-negotiable, as the body produces a significant amount of testosterone during sleep. For some men, especially those with significantly low levels and disruptive symptoms, a doctor might recommend testosterone replacement therapy, or TRT. This involves supplementing the body's natural testosterone with gels, patches, injections, or pellets. TRT can be very effective in alleviating many of the symptoms of andropause, restoring energy levels, improving mood, increasing muscle mass, and boosting libido. However, it's a serious medical treatment with potential risks and side effects, and it requires careful monitoring by a healthcare professional. It's not a fountain of youth solution but a medical intervention for a diagnosed deficiency. It's time we started having a more open and honest conversation about andropause. It's a natural part of aging for many men, and there should be no shame or stigma associated with it. By raising awareness, we can empower men to recognize the symptoms in themselves or their loved ones and encourage them to seek the help they deserve. Understanding andropause is the key to managing it effectively and maintaining a high quality of life, vitality, and well-being as men get older. If you found this discussion helpful and want to learn more about topics like this, make sure to check out my channel, Sex Education Repo.